All right, welcome back to episode 31, Free My Pain Now with Dr. Matt Doduro. And we have Dr. Adelina Isold, who is a naturopathic medical doctor at Metro Atlantic Diagnostics. Welcome. This is your second month.
Yes.
Well, welcome to our team over there. And today, you really have been focusing the last 2 months and really the last couple of years since you've been in Atlanta and seeing how the TRT device, which has been nicknamed the stem cell machine in a lot of categories, how that's been working with patients in your clinic. And maybe you can give us a little feedback. We're going to do some updates about what's happening with TRT company.
Well, I have seen nothing but great results with the patients, especially with the peripheral neuropathy, whether it be diabetic or chemo-induced, or for some patients we don't really know. Mm-hmm. But those are the patients that I really like to work with because I help them find the root cause to maybe why they have peripheral neuropathy.
Let's give a little history of who you are. Your father, Dr. Joseph Doduro, is the founder and developer of Neuropathy Treatment Centers of America. And a nice little shout out to Dr. Joe, who's doing some research down in
Costa Rica for neurodegenerative conditions, basically utilizing the infrared light therapy for those.
And he's trying to help with dementia and some other. Yep, he's moved on, but you're kind of picking up his research and the legacy that he's created here in the States.
Yeah, checking those small C nerve fibers with his
modified Toronto clinical scoring system, which we believe should eventually become the baseline for all patients before they start chemotherapy. Okay. And so what that's looking at, if your body is a tree, right? You have the trunk of the tree, and that's like our spinal cord. You have the large branches of the tree. Those are like our peripheral nerves that branch off and go to every cell, tissue, organ, muscle. And then you have the leaves of the tree, which are the small sensory nerves. Mm-hmm. Now, these are just underneath the surface of the skin, and they're there to help with protective senses, okay? So they keep us safe. If you touch something hot, you know to move your hand. If you step on a pebble or a pebble's in your shoe, you know to stop and take it out. Mm-hmm. Unfortunately, these patients with peripheral neuropathy, diabetic neuropathy, chemo-induced peripheral neuropathy, they lose those protective senses.
Those leaves are gone.
The leaves start to, not all of them, but, in modern medicine, they used to say to patients with peripheral neuropathy, "Oh, I'm so sorry, your nerves are dead. There's nothing we can do.
Yeah,
you'll have to live with it."
Condition.
Yeah. Your dad was one of the first people in this country 13 years ago, when he came back from Italy and kind of developed this protocol to show, he said, no, they're not dead. These sensory nerves are in a dormant or hibernated state. And he was the first to say, even though it's a nerve issue, the underlying issue is a circulation issue.
So bringing that blood flow with all those nutrients to feed those nerves to give them the opportunity to grow. And
so that was his premise, his hypothesis. And so he said, if you create a better environment for those sensory nerves to come back, and that's what he did. He used the low-level light therapy or polychromatic lights to have more blood flow and create a better environment for those sensory nerves to come back to life.
And we have seen great results with that. But at your clinic, we're kind of incorporating that and the shockwave therapy, which is, creating new blood vessels to the area and allowing more circulation. So those patients, even after, if you do that in conjunction with the infrared light therapy, we're seeing the color change on their feet. Their overall improvement. They get off the table, and as you like to say, their feet feel lighter. They have that sensation of, I can feel actually where the ball of my foot is touching the ground, things like that.
So the sensory nerves are so important. 60% of your balance comes from your feet and those sensory nerves. What do you mean sensory nerves? Most highly populated in our hands, the bottom of our feet, lips and tongue, and our sexual organs. They also give us pleasure. So when you eat food and the taste buds that you taste, those are part of your sensory nerves. So when my wife, and she was on episode 1, my first guest and favorite person in the world, Sherry Doduro, 5 years ago, she was diagnosed with stage 3 breast cancer. She went through, I believe, 2 months of chemo, But after 4 weeks, when they switched her to this Taxol and Cytosin, she developed chemo-induced peripheral neuropathy after the first session. And it is the number one reason why people and patients have to stop chemotherapy. So in her case, they had given her, with the type of cancer she had that was estrogen driven, they gave her an 87% chance of survival if she was able to complete everything. Well, her oncologist, when she saw that her hands she couldn't pick up things, she couldn't touch metal objects, they said, we're going to have to stop her chemo. And I said, wait a second, what does that do for her life expectancy, that survival rate? And they said, we'll cross that bridge when we get to it. And I was like, oh no. And listen, I don't know if you remember what I do, but we work with Neuropathy Treatment Centers of America, and we we use these low-level light therapy and polychromatic lights to help increase blood supply. Can we use these while she goes through chemo? And Dr. Tran said, as long as you wait 24 hours to allow the majority of the chemo to get out of her system, then you can do the light. So that's what we'd do. We'd do them on her hands and her feet twice a day for the next 13 days till her next chemo. And we would strengthen those small sensory nerves and boom, zap. So she was able to complete all 8 rounds over a 4-month period.
It's been 5 years. Has she had
5 years? March 9th is her
appointment?
Her anniversary date of being virtually cancer-free.
And another thing is especially working with those patients that we have. We have several patients that come in for chemo-induced peripheral neuropathy, and we're helping them with the lights in addition with the shockwave. And I feel like there is a place for my medicine in there because I help them with at-home things and supplementation to help them get
Absolutely. Through. And while we went through her chemo, we had a naturopathic doctor at cancer treatment centers who liked glutathione, who would, help to supplement a lot of that stuff.
Supported her so much, and I feel like it's not as accessible to a lot of our patients that,
This rolls us into our next, I'm giving you some updates, but we do have a magazine that has contacted us and wanted to highlight what we did to help her, right? Chemo-induced peripheral neuropathy is the number one reason why people have to stop cancer. And it was something that we, again, necessity, we needed to do this to keep her healthy, to make sure she got through her rounds. So this major magazine is looking to run a story about it. And we're excited to share that because not only, we're doing it on a local basis here in Atlanta, but now we're having
awareness, getting that word out there.
Other patients that are coming in, I can say it's Mrs. B. I'm not going to give her full last name, but she will be a guest on a future show. She is a nurse that works in a chemotherapy infusion center.
Yeah, and she sees it all day long, and she wants to see, because she actually suffered from it herself. She's like, I want to see if this works.
We just, on Monday, just did her re-exam after 12 sessions. She had a 41% improvement on her right side, a 42%, and a 51% improvement on her left side. And amazing. She was like, wow, excited because her oncologist, the group that she works with, is like, well, if this works on you, maybe we can offer this to others.
I love when I met with her, she goes, wait, I can't have my cheeseburger and milkshakes? So I'm kind of the death killer or like the fun killer.
Yeah, that's what you are.
The fun killer there at the clinic because I tell people, hey, you can't eat this, you can't eat that. But at the end of when they're done, they feel so good. They're like, oh my gosh, I'm going to keep doing like what you said because I feel so much better this way.
So, we're talking about diet. What's one of the reasons why we brought you on for you helped me so much last year when you put me on the modified keto. You helped put me on some great supplements.
And modify your intermittent fasting.
The intermittent fasting was awesome. We should do a whole episode on that. Maybe we can do the next 12 minutes on what ketogenic diet is and how to go gluten-free, what to avoid. But that'll be our second half of this episode. But, it's so important. We find that, a lot of it is getting that blood flow in there. But to maintain these changes, they have to be off statins for a while, right? 72% of our patients are type 2 diabetics. 44% have been on some type of cholesterol-lowering drug for more than 6 months. 15% have had some type of back surgery or spinal surgery. 10% are chemo-induced. And then about 5% are congenital or idiopathic. So we don't know.
The interesting thing, kind of diving in what you were saying, is
what we have actually patented the use of.
Sorry.
Make sure she's not on this next
just
episode.
Cut that.
We have patented.
So they don't do that.
This is a patent pending. We have taken the lithotripsy device, the polychromatic lights, and the Toronto, and we've patented them together to teach other doctors. And that's something that we're going to be launching in the spring. You're going to be helping teach other doctors.
As well as naturopaths. I feel like if they can use that in conjunction with a lot of their therapies that they're already doing, because how many doctors do you go to that support your diet and your lifestyle, making sure that they're exercising?
All right, in the next episode, we'll talk more about that. Welcome back to Free My Pain Now with Dr. Matt Doduro, and one of our previous guests. You're one of our returning guests. That's right. Thank you, Dale. And we're talking today about the chemo-induced peripheral neuropathy, the diabetic peripheral neuropathy. You know, we started as this niche clinic, and in Atlanta 11 years ago. And we have built this. We've got over 6,000 patients who've come to see us now. And that's just in the last 5 years. But what we're really seeing is how this lithotripsy device, how it's actually transformed our clinic from just a niche neuropathy clinic to an alternative pain center. And we see it working on people with golfer's elbow, knee pain, shoulder issues.
Low back, chronic
low back. I mean, and I'm just blown away that I don't care if it's 2 months or 15 years, the changes are just, it's amazing.
Well, and it's amazing because it doesn't take as long for them to, one, get the treatment, and two, get the results.
What did we talk about? I mean, our new marketing, we've got a really cool national TV spot that's coming out, and it says, you know, basically we can detect areas of inflammation and locate the true source of pain, and then start the healing process all within 10 minutes.
Which is, as a new doc that's working in the clinic that's utilizing the lithotripsy machine on patients, this also known as the shockwave, I'm seeing that. Patients are getting better right off the table.
And they love it. And they come back, even though there's some discomfort, right, Dale? We have pictures of Dale that we'll be showing. Well, guys, and as an update from episode 29, I was telling you we had treated, can I show you this? Or just hold it up to which screen? That one right there. That's Dr. Josh Axe and his lovely wife, Chelsea. And I went up there last Monday.
To Nashville, right?
Yep, to Nashville. And I delivered a unit to Dr. Axe. And I trained he and his wife, who's a licensed chiropractor, and he's a chiropractor plus also naturopathic background. He's wonderful. He is like the Dr. Oz of alternative medicine. He really is. And the stuff he's done is just, his ancient nutrition is huge.
Yes.
It's in some major
milestones, I guess.
It's
done really good
great
things
yeah.
because it's also now it's accessible, and that's the problem with a lot of alternative medicine, and it's good quality. So like I would never be, I would always recommend it.
Right. So he suffered from back pain for 4 years, as healthy as he is. And he is a specimen. I mean, there's not an ounce of fat on this guy. And he is having trouble doing the things he loved. He injured it doing CrossFit, preparing for a competition. And I think he was doing a clean and jerk, and he just hasn't been able to recover. His body hasn't been as much, and he's one of the healthiest people I know in bone broth and collagen, but his body has just not been able to repair and regenerate where it needs to. Maybe it's at that level. So I get texts from him every other day, and he's enjoying the
machine.
Yeah, he's enjoying it and the results. And he says, he's small incremental changes. But I told him, look, Doc, over the next 4 or 5 weeks of using this, you're going to have a transformational type of change.
Yeah. Because how long does it take your resident stem cells to get to the area? So more treatments, the more stem cells are being aggregated and brought there. Again,
short term, we should see less pain. We should see better range of motion, decrease swelling and inflammation, and that's in the first 15 hours. But the true healing is 8 to 10 weeks when you have your production and migration of the stem cells to that treated area, plus neovascularization, which is different from
blood vessels,
which is different from angiogenesis, which is just improvement of blood flow. Mm-hmm. So those two things together, and shout out to Eastern Nashville, who just suffered a terrible tornado that came through, and there were 23 lives that were lost. So our prayers for Nashville and that area that was hit so strongly. And I know that Dr. Axe and his family are safe, but our hearts and prayers are with the other families out there.
So I want to tie into with Dr. Axe. We got on that nutrition, and I know that on the last kind of segment of our episode, we wanted to talk about the ketogenic diet and intermittent fasting and this, how to support that. And I do find that doing kind of that modified ketogenic diet with a lot of our patients has improved their health and their quality of life because they're lowering those carbohydrates, which inevitably is lowering their sugars, and increasing those healthy fats, which is what all of our cells and nerves are made out of with that myelin sheath. So it's supporting them in that sense.
It's amazing. Again, it's a low inflammatory diet and lifestyle. What do you mean by inflammation? Well, inflammation could be a sunburn. Inflammation can be if a child is allergic to peanuts, they're going to have an inflammatory reaction that can cut off their breathing, right? So it's an anaphylactic type of response. So inflammation can be if you eat cereal with milk and wheat products,
cornflakes, high glycemic, and
that's like the majority of a lot of people out there are eating this. That's so fast, and they can get something
feeding it to their
body.
Kids because it's easy, right?
And elderly people do it. So this is just easy, but it's your first meal should be your best one of the day and the strongest.
Especially for our patients that do practice intermittent fasting, when they break that fast, it's really essential for them to break that fast with protein. Right? Because that's what you don't want our body to go into catabolic or breaking down.
Right. Yeah. Anabolic is building up. Catabolic is breaking down.
So we don't want to go in that kind of state and break down your muscles to use that as protein. So basically, if you break it utilizing protein like a protein shake or,
Dr. Josh Axe also has a PBS special on the ketogenic and intermittent fasting.
Oh, wonderful.
When you do break your fast, it's usually in the morning, then that's where they call it breakfast, right? Break fast. So those are good things happening. Well, also a couple updates for our listeners. I think I was going to tell you guys, I just got invited to demonstrate the TRT lithotripsy device out in San Antonio. I'll be out there March 16th and 17th working with the new head coach. Her name is Rose Monday of the Women's Olympic track and field team.
That's so awesome.
Boom. I'd shake your hand, but that coronavirus thing.
Yeah, we should.
So, but that's big and excited. They were just in town. Coach Monday was just in town here in Atlanta this past weekend where they ran the marathon, and the top 3 finishers will be going on to Japan if the Olympics are held. Hopefully we can get over this. I loved how President Trump says as soon as it warms up in April, it should get better. Yeah, hopefully it does.
And then we got global warming supporting us. So that's
so, yeah. So let's keep this non-political. But so that's pretty exciting. I also am we're supposed to go to the Pentagon on Friday, the 13th, but apparently they were freaked out by that date as well. So it's bumped now to the 19th of March. So myself and the CEO from TRT, John Warlick, will be heading up there. We're going to be meeting with a wonderful Dr. Vega, a medical doctor who is in charge and helpful of putting all new technologies into the Veterans Administration system in our VAs.
That's going to be awesome.
Yeah, that's great. So we'll see. I mean, if it works well and everything goes well, it does. I mean, the thing I know this
hopefully.
That's right. I know this works. I just don't know how fast it works.
Mm-hmm.
But you've seen some patients. What was that one patient who had the hip problem?
Yeah, his
Dr.
main
Conrad?
goal. Yeah, he was a dentist. His main goal was he wanted to be able to play Frisbee with his grandkids. And so that lateral movement with the Frisbee was very challenging for him. And he says, getting out of a car. And he came in and he's like, it's my right hip. It's my right hip. He was so convinced. So we treated his low back SI as well as that right hip area first visit. And then in the following visits, he was like, he would always grade it for me like 0 out of 10 pain. He does always get to a 3 or 4 when I would actually use the technology on him. So not quite the response I was hoping. I said, let's do the origin insertions of these muscles. So
Where'd
we
you
went
learn
down
that from?
medical school.
Me, look up, look down, look all around. That little phrase.
So basically treating the area above and below the injury. So we treated his knee. We started on the right knee, and then we actually did move to the left knee. He was amazed by the amount of pain, but also improvement he had just by treating those other areas, as well as his left side. We treated the opposite side of the injury, and he says, getting out of the car is easier. He's showing new ways to throw the Frisbee to his grandchild.
Yeah, I have. I mean, it's pretty wild to listen to patients' goals, right? It's not just about getting out of pain. It's about experiencing life and enjoying it and
improving the quality of
so
life.
That's what we're shooting for. I tell my patients, our staff and our team every day, they're like, oh, this patient is so grumpy. I'm like, you have no idea what it's like to live in pain for these weeks and months. So we have to cater to them. We have to acknowledge them. And it's so fun to watch the transformation of these patients who are
grumpy. And then they come in and they're out of pain and they're so grateful, and they're just, you can see themselves.
They tell everybody.
Back out. Yeah.
We have this deal that we do with all our patients. We say, listen, if we're able to help you, will you make a deal with us? And they're like, sure, because nobody's helped them at this point. It's like, if we're able to hit these 3 goals and decrease your pain, improve your range of motion, improve your mobility, help your sleep, will you tell others? And they're like, oh, yes. So I shake their hand, or I used to. And then, 2 weeks later, we see Dr. Conrad, and he's like, hey, I'm Frisbee again. I go, remember our deal? Yeah. And he's like, what is that? I'm like, that you're going to tell others. He goes, I already have. I've been telling this guy and this guy. And
yeah, we're running out of pamphlets at our clinic.
I know. Well, the cool thing is we've got a nice national TV spot that's going to be airing very shortly. We're just editing the last things. I can't wait to show you guys as well.
Features Dr. Doduro.
Dr. Doduro, not really, and a couple patients. But it is exciting because this movement is happening, and every center across the country that has one of our TRT devices is going to have access to this. And it's really about your network, right? How do you get the message out? Yes, it's good to be a good technician, but it's also better to be a good educator. And that's what we're trying to do every day. Free My Pain Now. Thank you all.